Hi, I'm Kayla. I'm going to be presenting on neonatal neurodevelopment as it is very applicable within our NICU. I'm doing this capstone project for my BSN program at Florida State College of Jacksonville under the supervision of Professor Dr. Peggy McCart. So the project objectives are to identify a problem, search for the best evidence, research and determine the best practices, and identify the practice differences. So let's look at the problem. A problem within our NICU is the neurodevelopment of our neonates. Premature infants are infants that are born before 37 weeks. Infants that are born prematurely have not had the time that's needed to develop inside of the womb. The most crucial development of a neonate occurs between 24 and 40 weeks. Knowing this, the neonate is underdeveloped and is now having to develop outside of the womb, which can lead to developmental disorders. Neonates experience a great deal of stress within the NICU and easily become overstimulated by our interactions. These stressors can lead to harmful effects on their sensory system. So what are we looking for within this evidence-based practice? We're going to ask the question, in premature infants in the NICU, how does music therapy and family-based care compare to infants without therapy and care affect their neurodevelopment within their length of stay? So within this project, I did some literature review to help back up and research on the neonatal neurodevelopment. For this research, I searched keywords like music therapy as well as premature infant to locate the articles. I also limited my years to 2016 to current. So article number 1, benefits of a comprehensive evidence-based NICU MT program. Family-centered neurodevelopmental music therapy for premature infants. This article was written by Stanley and Gutierrez in 2016. They gathered 20 years worth of data, totaling 49 articles. This article specifically looked at music therapy and family-centered care being involved in the neurodevelopment of the infant. Overall, they found that music therapy led to two things, alone and combined: stress reduction, as well as earlier discharge. Article number 2 is, do hospitalized premature infants benefit from music interventions? A systematic review of randomized controlled trials. Article number 2 was written by several authors in 2016. It used a total of 20 studies, which totaled over 1,100 participants. It was a systematic review of randomized controlled trials, and the last systematic review that was published prior to this one was in 2009. 13 electronic databases were searched for the research. Results developed 26 outcomes. These were categorized into 3 separate categories. These are improved growth and feeding, improved behavioral state, and relaxation outcomes and pain reduction. The studies showed that music showed promising results, but due to variation in age in studies, it made it difficult to determine strong results of this research. So, stressors that the neonate experiences within the NICU. Stressors affect the neurodevelopment of the neonate due to overstimulation. Prematurity also comes with underdevelopment of the brain. The brain must continue to develop outside of the womb. It is crucial to the development that we are aware of the stressors that can affect this development, including, but not limited to, positional changes, inappropriate handling, and excessive lights and sounds. And inappropriate handling consists of touching too often, causing interruption in the neonate's sleep and time to rest and grow. All of these stressors can go hand in hand together. So there are different types of music therapy. You have live music and recorded music. Live music consists of lullabies, singing, sometimes accompanied by guitar or other musical instruments. Recorded music can consist of a recording of a parent singing or pre-recorded lullabies on a musical box. There are many music therapy outcomes. Based on research we're hoping for when we use this type of therapy. Physiological stabilizers include heart rate, blood pressure, and respiration rate. Music therapy has also been shown to decrease crying and reduce pain. Due to music therapy and interactions with non-nutritive sucking and eventually feeding, it has been shown to reduce the length of a hospital stay by helping the neonate feed well. Weight gain is also seen as an outcome due to stress level reduction, which keeps the infant from getting worked up and burning too many calories, and also due to feeding well. Improved oxygen saturation is also a good outcome of music therapy. Family-centered care consists of involving the parent or parents of the infant in participating with their cares and teaches them how they can be a part of their infant's day. Family-centered care with the involvement of a NICU MT. With the involvement of a NICU MT, which is a music therapist, family-centered care is beneficial to the parent as well as the neonate. The NICU MT helps teach parents how to use music therapy to cope with stress. Along with these stress reduction techniques, parents may need emotional support, which the NICU MTs are able to also provide to them. NICU MTs also provide age-appropriate training to the parent, along with music therapy. They are able to help the parent or parents create a personal lullaby for the neonate that can be played in the absence of the parent. In the event of a neonate passing, the NICU MTs are also able to help the parents by creating a remembrance, and this may include the neonate's heartbeat to a song. So we're looking at outcomes for family-centered care. Stress coping taught by the NICU MT reduces parental stress and increases parental involvement. With the teachings from the NICU MT, parents develop a better attachment and feel more empowered with the care of their neonate. They're able to spend time and provide care to their neonate while avoiding overstimulation to promote neurodevelopment. All of these things combined help to improve the neonatal state. So let's look at how we can incorporate this project and research into our facility. We can look at less stressors for the neonate. How are we able to provide less stressors to our infants? Are we sticking to their care times? Are we handling them appropriately? Are we doing minimal positional changes? Are we making sure that they're not having lights and sounds and everything interrupting their rest? Are we providing music therapy where it's appropriate? Are we involving the family? Are we teaching them about how important care times are, how important it is to stick to those care times and not interrupt them in between their care times, allow them rest, teach them how they can be involved in their care times? Are we sticking to the golden hour protocol? Golden hour protocol consists of 72 hours of an infant less than 32 weeks gestational age. Are we sticking to that golden hour protocol? Are we keeping them midline? Are we minimal position changes every 6 hours? Are we sticking to that every 6 hours care times? Are we providing sound machines or music boxes where we think it's appropriate? Are we teaching parents about kangaroo care? Are we promoting this? Are we allowing the parents to do skin to skin where it's appropriate? All of these things can be incorporated into our cares and our facility.